To a GMA health alert, the CDC reporting levels of whooping cough in this country are higher than we've seen in a decade. So let's go ahead and bring in ABC News medical correspondent Dr. Darian Sutton to talk about this. Good morning. Thank you for being here. We are really seeing a surge right now. What is going on?
So the numbers are the highest we've seen in almost a decade. So we're talking about a respiratory infection, Gio. This starts off as a cold-like symptoms for maybe 1 to 2 weeks and then progresses to the second stage, which we call a 100-day cough. These are coughing attacks, can sometimes make patients vomit, and those who are most at risk are those under the age of 1. But I just want to show you some of these numbers. Just here in 2024, we've surpassed 17,000 cases.
Wow.
Now, that's more than we've seen last year, around 3,000 cases. And this cycles every 3 to 5 years, but right now we're certainly in a surge.
And that sounds so miserable when you talk about those 100 days of coughing.
Yeah.
Obviously, parents want to know, how do we protect our kids?
Well, number one, vaccinations. Vaccinations are the most effective way to protect against this infection. It's caused by the pertussis bacteria. Now, this is the common vaccination that we give kids between the ages of 2 months and kindergarten. It's about 5 doses, and for adults, it's every 10 years. But the most important are pregnant patients. In their 3rd trimester, we encourage it mainly to protect, again, the most vulnerable, which are children under the age of 1.
Okay, so in the 3rd trimester. All right,
Absolutely.
Thank you so much, Dr. Darian.
Of course,
Really
hand washing, masking, all of these other things protect against
things.
respiratory viruses as well.
And I'm sorry, you know I wasn't going to let this end without getting a question in, because you know little baby is not yet 1. Okay, this is included in their standard vaccine, so I don't
Absolutely.
need to ask for
You
this
don't need to
additional-
ask. And then we also believe in cocooning children. So those kids who are not fully vaccinated, the word cocooning means surrounding them with vaccinated individuals. So that's how we best protect against, for those specifically who are most vulnerable.
So caregivers should also.
Absolutely, I believe so.
Okay. That
as
was
well
2
as be
questions.
trained in
I
CPR.
needed to know.
And
but
they were better questions than I asked,
And
so
I'm
thank
taking
you.
that home, texting my husband now. We appreciate otherwise I would have texted you later to ask. Thank
I'm sure you would have.
very much, Darian. It is great to have you.